Hey guys, so I am in Pretoria to wash my teeth, and yeah, man, I'm a bit scared because I haven't washed them in a while, simply because sometimes we think these kind of services are available to a certain tax bracket, but I really love that Pixie Dental Care is quite affordable. I'm literally washing my teeth for 500 Rand, guys. Like, that's a bargain. So, yeah, let's do it. These are the big machines, guys. This is your doctor. So, yeah, this is the machine. You will sit on this seat, which is very comfortable. I wanted to sleep actually. And then I think this is the camera, ne?
No, this is the light.
The light.
Okay.
Somewhere here there's
light. And that's the intraoral, the screen, and the camera is on the side.
Yes, this is the screen. This is where you see how your teeth look before and after, and the camera is on the side. Okay, I'm about to wash my teeth. Please look at how my teeth are, ne? Don't be fooled by the lighting. The lighting in here is very good, so our teeth look relatively white. But I want you guys to see how they look afterwards. So guys, this is the first procedure. You have to open a file when you get here. We're gonna do that. This is the file. Let me show you guys the file. This is how it looks. Obviously, I'm not gonna show you guys when I fill it in because that's personal information. So nope. We are gonna do that. That's what you do first. It's 500 Rand, right? So it's consultation.
Yes.
Opening the file is part of consultation.
That's true.
Okay, cool. You heard it, right? So then it means that you don't just open a file. You actually open a file and then
We get to do something.
you get to do something. Cool. Let's get on with opening the file. See you guys just now. I don't necessarily have a lot of questions. I think for me, my worry is, I think the uncomfortability of just opening your mouth. You know how you're just very conscious, and I think it's not just me. A whole lot of people maybe do have that kind of fear of yo go bula molomo, and So I don't know, how do you then make your clients comfortable in that regard?
First of all, I need to ask you, have you been to a dentist before? Because approaches differ with clients. Some people are familiar with the dentist, they've been here since they were 6 years old, and then they are calm. But then when you come here at maybe the age of 20 for the first time, it's a different approach.
Yes.
First of all, I need to deal with your nerves. Of course, it's for the first time, and then we take it from there.
Okay, because I have been to the dentist.
And also the past experience with our dentists, we need to deal with that. Actually, we deal with your psychology first, from there we can continue.
I love that you deal with the mind first. I have been there, but I was just taking out one of my teeth because it was it had holes in it. Because we are washing, and you and I had a conversation off camera, you said that if you're washing your teeth, you include a checkup, no?
Yes.
You do.
Usually all our treatments include checkup. When you come here first, the consultation, we check, we do a holistic, we check everything in your mouth. We don't get to focus on your main complaint. Of course, you tell us your main complaint, but during the consultation, we get to check everything. If we identify anything wrong, we tell you as well. But then we're gonna focus on your main complaint, but we do check everything.
Guys, also my wig is so ashy, I can't. Anyway, that's besides the point. Let me tell you guys, I'm so scared. You know why I'm scared? Because I eat a lot of sugar. Ne? I'm a sweet tooth. I'm a terrible sweet tooth. So my fear is that what if the doctor discovers that there's so many holes in my teeth because it's bad. They buy sugar. It's bad. But anyway, we shall find out. Also, by the way, this service, washing your teeth, is 500 Rand. And it includes her telling you what your problem is, and also just washing your teeth. So you know what to do. I'll leave the context down below.
Examination, checking. What's in there? Open for me. Okay, first I need to check that's open. Close. Open. So another thing that we do, we check your TMJ. Some patients, they come here, they're not aware they have the joint problem.
Oh.
So sometimes we pick it up.
Okay.
Or it deviates. Open, close, open. So okay, in your case, it's okay. It's important to brush your teeth almost every day, twice a day, in the morning and before bedtime.
Okay.
So if you only brush once, for example, you brush today, now at 8, and after that you have your breakfast, during the day you eat, everything, then you only get to brush tomorrow morning.
Yes.
It's like you spend 24 hours without brushing your teeth.
Okay.
And the food gets to accumulate the plaque buildup.
Okay.
Remember, we have normal like bacteria in the mouth, but the more they feed on the byproduct, the carbohydrates, the food that you eat, the increasing number, that's when they start producing acid. And also, once they attach to your teeth, they create a rough. Anything can attach there. Once it attaches, initially it's white, but the more you eat your spicy food, color food, then it changes color. Your coffee, that's when you get to see brown or yellow. Yes. So the danger part about it is that it gets closer to your gum line. So when it gets to the gum, there's a space between our teeth and our gums. So once it gets there, it starts to irritate your gums. Then you start to have like swelling.
Okay.
And then inflammation with time. You will bleed. When you're brushing, you will bleed, and then you will experience the bad breath.
Okay.
Because it's just a build-up every day. And once it hardens, we call it a calculus. It's a tartar. When you brush, you can't even remove it. You can try so many things, it won't go away unless you come to us. Then we do the scaling and polishing using our machine.
Is this when you start having bad breath and
Yes, the thing with plaque, if it's like food that are trapped inside your mouth, like between your teeth, get stuck there. So overnight, even the next day, if you don't brush, you'll start to experience bad breath.
Oh, I see. And then how many times should we like then have this procedure of checking our teeth?
After every 6 months. Twice a year.
Okay, so I don't need to come every month.
No.
Okay.
So if you get the brushing technique and the home care, like I'm telling you now, brush your teeth. Make sure with any fluoridated toothpaste, it doesn't have to be a specific one, especially if you don't have any problem. Any toothpaste in the market that has fluoride, use it. And when it comes to the toothbrush, we normally advise people to use the soft or medium toothbrush, because the society thinks that when you're using a hard brush and you're scrubbing hard. No. Okay. So basically, we get to check every tooth, not only teeth but the soft tissue. So now I picked up something there at the back, just to get picture and show you. Even here, the few of your teeth that needs fillings. Yes, and then here I picked up. Remember, you wanted braces. You wanted to fix this. Yes. There's some teeth that are out of line there. Okay, stick your tongue out for me. Say ah. Sometimes you have some laceration under the tongue, so this is the time to pick them up. Okay, so I'm going to use some camera here to just open for me. Open for me. Open again wide, try to open wide. The harder it is, especially if you're using the wrong technique, it's gonna cause you more problems.
Okay.
Because people, they scrub their teeth when they're brushing, which is wrong.
What is the right technique?
You have to use the circular motion and be gentle.
Like this?
Yes, with circles. I'm gonna just show you now.
Okay.
Circles, and be gentle, and for about 2 minutes you get it right.
Okay.
Okay, so like the structure of the tooth, we have that white part that you see on the outside, which is hard, and it's got no nerves, like no sensation. We call it the enamel. That's why we can drink hot or cold things without feeling anything. Then you go on the inside, it's yellow in color, it's called the dentine. And then we go inside for the pulp chamber where there are nerves and everything. Remember, our teeth are alive. As much as your hand and everything is the same thing, it's a bone as well. And then underneath, what we get to see with our naked eyes is the pink part, which is the gums. But underneath the gum there's a bone that keep our tooth in place. That's why we can eat anything without having like deflection or our teeth moving side to side, because there's a bone that puts it intact. Yes, this is it. So what I was trying to explain with the layer when you're brushing, let's say for example you have that hard toothbrush with your toothpaste that has got granules, and every day you are scrubbing and scrubbing and scrubbing. With time you are removing that layer, the enamel, the tough one. So once you get to lose the enamel, then your dentine become exposed. Your dentine is not as tough as your enamel, and it's more softer than your enamel. So once you get there, then that's when you start experiencing sensitivity.
Okay, that makes sense.
When you're brushing, this is soft.
Yes.
It's medium. Then you just apply your toothpaste. I know some they put it from here up to here. It's not necessary. You can just use the pierced. It's also fine. Okay. Because the main aim is to distribute fluoride across your teeth. So what you do, you can just start at the back. Right there, you can just like circles like this. You can make about 8 circles, then you move. You make sure you don't skip anything. Same thing. Then you can just open a bit, focus on this part with circles like that, soft, gentle, even the other side. Some people they come here like the outer part is more like clean, pure, like no plaque or yellow stuff. But as soon as they open their mouth, you get to realize, oh, the inside, there is a problem. Because sometimes they will tell you that it's difficult for them to place their toothbrush on the inside. Or even the proper way of brushing on the inside is difficult. So on the inside, you can just, you see what I'm doing? Brush this way, as if you're sweeping out. Sweeping out. Here you can place your brush like this as well. Sweep. You can either decide to do circles, but sweep. Even on the top. And then where you can scrub actually is here. On the chewing surface. Here you are allowed to scrub. Remember, we've got fishes, some are deep, so food gets stuck in there. Then you can just scrub here. And the other thing that people forget is their tongue. So you can brush your teeth. Find that you don't brush your tongue, you'll still have bad breath. Because even plaque do accumulate on your tongue. So after that, you can just brush your tongue as well. Then you rinse. And that's it. So there, remember, like brushing alone is not like enough to keep your mouth like clean. So we also advocate for people to start flossing. Remember, there are spaces in between our teeth, and then when you brush, our brush don't reach those spaces in between. So we advise our patients that you must use a dental floss.
What is flossing and what is a dental floss?
This is dental floss. It's like a thread. It's a thread like this. You can just cut it like this, and then you can just roll it on this finger like this. Okay.
And then you put it in between your teeth.
Yes, in between your teeth, but you don't just put it like in and out just like that. When you put it in like that, that means you're just taking out food that are stuck in between your teeth. You put it in, and then you place it more like you are hugging your tooth. Then you take it down, up and down, down like that for about 8 times. Then from there, remember when you use this part, then we assume that it's dead, because whatever that is in there is food, plaque, all those things, the bacteria are in there. So once you floss one tooth like this, then you unroll it there, then you take the clean portion, you move to the next tooth. Then you floss like you form a C shape around the tooth, then you take it up and down like that multiple times, then you move to the other side of the tooth, same thing like that. So you can't use a smaller floss for the whole mouth, because whatever that you take on this tooth, you'll be taking it to the other one. So you roll it like this. As you use it, then you move along.
Move it. Got it. All right.
So we have this as our scaler, is the instrument that we'll be using. It causes some vibration the minute I press on the button here, and it's gonna vibrate. The water will be coming out, And then the other thing is the water piles up in your mouth. You just have to breathe through your nose. There's gonna be a suction that will suck the water out. So
Hectic.
Yes.
Sounds scary.
Okay.
So, okay, dira so.
You don't
How?
do that. You just
How?
get to open your. Just keep your mouth open.
Okay. I can't come. Oh, it's a polishing paste.
Yes.
Okay. So that, because I thought my lips were dry and like. Yeah, wow.
It's fine.
Okay.
So now I have to take the key. So it shows where that yellow thing, the plug thing, was seated.
Okay. So now this is the end result.
Yes.
And obviously, so that people are not confused, this is a little bit of bleeding, no?
Yes.
Yeah, that's normal. And then this one.
This one is, remember, I told you there are multiple teeth that needs to be filled.
Yes.
And together with the other ones. Yes. So when you come back again, you're gonna do the filling on
The filling on this one.
Yes, basically we just remove the black thing and then we put in a
Okay.
filling. It's like we are stopping decay from
Okay,
the
cool.
tooth decay.
All right, got it. So yeah, guys, this is how my teeth look now. This is the thingy after cleaning my teeth. And then this one,
Even that.
even this is how clean it looks, guys. This is how it's borderline white, basically. And then obviously she did explain that this there's still a bit of black because it needs filling. So I need to come back and do the filling. How much is the filling? 500 rand per tooth.
Yes.
Okay. And then yeah, guys, that is it. My teeth are clean. Let me show you guys in real time. This is how my teeth look. Oh, I think there's like a yellow lighting here that's making them look yellow, but they're not yellow. Yes, this is how they look, basically. Obviously we're gonna have to come back for more procedure and things like that because it's they do check up, but obviously you can't pay like 500 rand for everything. So yeah. And you spoke about my teeth being not aligned here at the bottom, because that's what I was concerned about.
Because yeah, the only problem, they're not that severe, but then the only problem that you'll face, the challenge, is when brushing your teeth. If teeth are not aligned, brushing is difficult.
Okay.
That's why you find, especially on those areas, the yellow things. It's only there where there are yellow things, because when you're brushing, you tend to skip because they're not in line with the other teeth.
Okay.
And our brush is not shaped in a way to reach like those
okay.
areas.
All right.
Yes. So for you, ideally, after every 6 months, you should be coming for your dental treatment, or even using a dental floss.
Okay.
3 times a week, and try to do it at night, because most of the time when you do it in the morning, probably you have to go somewhere and there is no time. But
No time.
During bedtime, you can just relax in front of your mirror and floss and floss and floss until you get it right.
Okay.
But in your case, you need to floss. Actually, everyone needs to floss 3 times a week, like minimum that you can do. But then in your case, you need to, because remember, your bottom teeth are not like straight. So if you miss the other areas, there's gonna be like development of plaque, yellow things.
Yes.
Problems.
And how much is it to like to make them straight?
Oh, okay. At the moment, you're gonna need like an orthodontic treatment. We don't offer it at the moment, but then it varies. Like, yeah.
Okay.
As soon as we start, then we're gonna just put
Okay.
start there.
So I'm just gonna have to wait for that and then come back. Okay, cool. I think I learned so much, guys. Even just about brushing your teeth. I didn't even know that you brush your teeth in circular motions.
Yes.
And that's like information that's not readily available for us. And like I said, guys, when it's black female owned, it means that there's a little bit more like education even in the process. You know, she just doesn't, you know, she's not like those doctors who get in and they're like, do what they need to do, and you go. She teaches you how to brush your teeth, how to floss, and I feel like that's information that people should be paying for, but you don't make people pay for that kind of information.
No, it's free, like giving oral education.
Okay. All right, guys. See you just now. So, guys, I got this. It's a home tray. Take home tray. It's a bleaching tray. So, how do I use it?
So you just have to like, okay, the tray you are written the upper and the lower, and then you just peel it off here, maybe at night. Then you place it on the upper and the lower. Make sure like there's a gel inside.
Okay.
You distribute it, then you just bite on it.
Okay.
Yes, there's gonna be a bit of sensitivity, but I usually say like 15 minutes if you can. Just put it there.
And how long can you use? Can I see it? How long do you use it? Is it like
it is a once-off thing?
Once-off thing. Yes. Okay, guys, this is like our thank you gift. So that's the nice thing about it. If you come here, you also get a thank you gift. So yeah.